talking Big Ten football.
I assumed as much. I saw the no comments yesterday, and I assumed you'd be showing up for comments somewhere from someone. Ready to go, Brandon?
Yes.
Okay. Thank you all for joining us here today. My name is Taylor Gage. I'm Director of Strategic Communications for Governor Ricketts. In just a moment, Governor Ricketts will be joining us along with the state colleges and private colleges. We're going to be talking about plans to get students back to school here that's occurring this week for some folks. We'll start, as always, with questions that were submitted ahead of time and then questions from here in the room. And if you're broadcasting, please keep Francis in your shot throughout the program. We'll get started in just a moment.
Oh, yeah, I'm just getting started.
Thank you.
Morning, Francis.
Good morning.
How are you today?
I'm good. Yourself?
I'm doing well. I'm doing well. All right. Paul, if you want to just stand, you can stand right over there. That'd be great. All right, good morning, everyone, and thank you for attending our press briefing with regard to the state's response to coronavirus. And today we will be doing another one of our back-to-school press briefings, talking about getting our students back into classrooms. We do have a couple of guests. We got Dr. Paul Turman, who's the Chancellor of the Nebraska State College System, so thank you very much. And also Daren Good, who's the president of Nebraska Wesleyan University. Also in the audience, we have today Treva Haugard, who's executive director of the Council of Independent Nebraska Colleges Foundation, right? Got that right? So thank you very much for joining us. And let's see. So we will start, as always, reminding people that we want you all to continue to practice our good social distancing guidelines. So remember, when you go out in public, keep that 6 feet distance between you and other people. Wear a mask when you go to the store. Make sure you're washing your hands often for 20 seconds at a time. If you see a crowded bar or restaurant, good opportunity to go pick another place to go. Those are all things that we can do to help slow the spread of coronavirus here in our state. And also remind people that the reason we're doing this is to protect our hospital capacity, right? This is a virus. We can't stop it from coming. The virus is going to come. But what we can do is make sure that everybody who needs that really acute care, that have that hospital bed, that ICU bed, that ventilator, gets access to it. So currently, today in the state of Nebraska, we've got 41% of our hospital beds are available. We've got 38% of our ICU beds available, and 82% of our ventilators are available. Also, if you're looking at just in general, how many coronavirus patients are taking up those ventilators? Like I said, we have nearly 20% or 80%, 81% of our, 82% of our ventilators are available. I think if you just look in general, less than 4% of our ventilators are being used by coronavirus patients right now. So most of the ventilators are being used by patients for other reasons. Same thing for the hospital beds. I think we're about 4% of our hospital beds, a little bit less than 4% of our hospital beds are being used right now for coronavirus patients. So we've got very robust hospital capacity. So that is the benchmark we are using here in the state of Nebraska, is making sure we can provide that acute care, and we've been able to do that all throughout this pandemic. We've been very successful, and we continue to have capacity to be able to do that everywhere in the state. So even in Douglas County, we've got about 6% of the hospital beds, I think, are being used up by coronavirus patients. So very small numbers of people in the hospitals with coronavirus. Another way that people can help fight the virus here is signing up for testnebraska.com. It's a great way to be able to get signed up, monitor your health, go in and get a test. And for example, if you're going to go visit relatives and you want to get a test, that's a great opportunity to get a test to make sure that you're negative before you go visit relatives. That's another opportunity. So far in the state of Nebraska, through this pandemic, we have tested 302,000 people. 140,000 of them have been through testnebraska.com. So sign up for testnebraska.com. It's a great way to do it. And we will continue to be doing that testing. So we do find those folks who are positive, we can get them to isolate. We will do the contact tracing to get their contacts to quarantine if necessary. And again, that's the blocking and tackling of how you handle pandemics, is finding those people who are infected, getting them to stay out of the community so they don't infect anybody else. All right, so now we're going to talk about back to school for our state college system and for our independent colleges. They all have been working on plans for how to bring students back. They're looking at what they can do to be able to create more space within classrooms, looking at PPE, looking at doing screening, all the sorts of things that will help be able to make sure we can successfully bring students back into the classrooms this fall so that we can continue that academic progression with our state college system and our independent colleges and our private colleges here in the state of Nebraska. They've all been working very, very hard to be able to accomplish this. So with that, I'm going to go ahead and turn over to Paul Turman, who is our chancellor for the state college system, and have him talk about some of the steps that they are taking with regard to making sure we're mitigating the spread of the virus in our communities. Paul?
Thank you, Governor Ricketts. Good morning, everyone. Certainly appreciate the opportunity to spend a little bit of time talking about the work that we've been undertaking here over the last couple of months to be prepared. I think I'd like to also just commend the governor and the state agencies for a number of things. The governor, for the last couple of months, has been pulling together the higher ed leads from each one of the different sectors, so we could come visit with him, be able to go through the process of learning from each other about what we can do to better prepare our faculty, students, and staff. Have certainly provided us with a wide range of PPE that will help us mitigate the spread once students return to campus here next week, in addition to making sure that we have the testing capacity in place as well through Test Nebraska. And so that work has been very significant. Some things that our campuses, even our system, would not have been able to do on its own. So in June, the state colleges notified our students that we would be proceeding with in-person delivery for the fall 2020 academic year. Within that, we work to compress our academic calendar, much like a lot of other institutions around the country, try to limit the number of contact days and interaction that our students and faculty would have. Being able to start a week earlier, but also finish by the time we hit Thanksgiving, so that it also freed up the opportunity for us to be able to do a 3-week D-term for students to be able to return back to campus if we're not seeing significant spikes, but also continue on with their academic experience in ways that in the past we've not been able to do in the very extended, long kind of academic terms. all of our classes that were designated as face-to-face back in the spring when students went through and did registration are still proceeding in that fashion. So if we had online classes, we're still honoring a number of those, but our goal was to try to continue on with the same experience that we had anticipated, just with the academic compressed calendar. So we are engaged in this process of trying to eliminate the number of students that are in our classes, but at the same time trying to create social distancing, encouraging students to wear masks, actually requiring students to wear masks once they're in the classroom as they transition between classes, and then any place on campus where they're not able to be able to socially distance appropriately, that they're engaging in and also accepting that that's an important piece of what they're expected to do. I think also what we're seeing is our campuses have taken a different approach to the way we approach attendance. And in the past, not a lot of faculty were required to take attendance, and we've asked them to do that simply because we want to know when a student is not coming to class, so that individuals on the campuses who are engaged now in making those connections with students are able to follow up. We're also taking a very alternative approach to saying that we're not going to penalize students for not coming to class. We want them, if they're not feeling well, if they have symptoms, that they're feeling that they have every capacity to be able to stay isolated and then come back when they're ready. And so we've implemented a good number of kind of blended classroom structure, the flex classroom delivery. At any point in time, I think we'll feel comfortable that a class, whether it's one student, a cohort of student, or the entire class itself, if it had to move to remote, we're ready to do that, identify when it's possible to bring them back, and then get them back engaged in the face-to-face engagement as quickly as possible. I think what we're seeing is that we're creating a different classroom or college experience for our students. Some things that they're going to have to get used to, whether you're a new student to the state colleges or that you are returning. Some of the things that you were able to do in the past, we've just come to realize that we have to structure things a little bit differently. I think the key to our success really is going to be our ability to build a community, a college community that really supports each other. And so the ability to go through and foster a campus community or a culture that follows the recommendations and the guidelines that we've laid out is going to be essential. We've had a very small number of students that once we said we're moving to face-to-face, that indicated, no, I would prefer to take just simply online, sometimes as few as 5 to 10 students at any given campus. And so I think that's a testament that they want to come back and do it in person. And so to do that, you have to kind of pledge that you're going to follow along with the guidance that we've outlined. And so each one of our campuses have implemented or branded it unique to their institutions. Protect the Nest at Chadron, fulfilling the 4 pillars of engagement at Wayne, which becomes just the things that the governor has been talking about for the last 6 months. Engage in good hygiene, make sure you're doing social distancing when possible, wear a mask when you can't do that social distancing, and we've outlined places where that's going to be required, and I think students are getting equated to that. And so we provided them with masks that are unique to their institutions to hopefully try to foster that. The last piece of that is really the screening process. All of us, I think Daren will talk a little bit about the applications that we've adopted, encouraging students to monitor their health, be able to identify when something is amiss, that you're symptomatic. How do people on our campus begin to work with those students and the local public health to help ensure that if they need to get tested, that they can get tested as quickly as possible. If they need to be isolated, we can do that, or quarantine them so we can return them back to the student population as quickly as possible. Overall, I think I'm extremely optimistic, along with my presidents, that we're going to be able to do the right things and put students in the environment that's going to make them safe. And in doing so, I think we're going to have a very successful fall term, compressed fall term at Chadron State, Wayne State, and Peru State as well. I think I just want to end thanking the governor and the legislature. I think the passage of LB 1080 last week was very significant to the state colleges. The creation of the Career Scholarship Program, as well as the Corrections Pathway Program between the Department of Corrections and Peru. I think it really does signal that the message is that despite the pandemic, that the state of Nebraska is going to continue to move forward and address the workforce shortages. And I think these programs will ensure that the students we are able to attract go into the degree programs that are really needed for the state. So appreciate the opportunity. I'll be glad to answer any questions you have at the end. Thank you. Thank you, Governor.
Hello, I'm Daren Good, president at Nebraska Wesleyan University. But I'm here to be clear to represent all 13 private colleges and universities. There are 13 schools throughout the state of Nebraska that belong to the colleges or the Council of Independent Colleges. What I want to do is start by representing that group and thanking the governor and the state. The health departments have been phenomenal. The governor has been very supportive and, as Paul mentioned, has been willing to meet with us regularly, but also great communication between the governor's office and the schools. So to give you a little more background, the colleges and universities that I represent have over 35,000 students that we serve. Over 30% of the bachelor's degrees given out or earned in the state of Nebraska are from one of our 13 institutions. 45% of the business degrees, 35% of the educational degrees, 50% of the health sciences degrees. We generate $1.4 billion a year annually in Nebraska and employ over 14,000. So and we often are forgotten because we each are independent and have our own specialties and highlighted experiences. But what I can say is we've come together and worked in unity on addressing issues of the pandemic. We've shared best ideas. We've collaborated on how to put together processes and protocols collectively with the CINCF, the Council of Independent Colleges, in order to collect our needed requests for PPE, including masks, gloves, hand sanitizer, et cetera, from the state, which has made a much more streamlined ability for us to receive a great deal of added help in protecting our campuses, students, faculty, and staff, which in turn protects the communities in which we live. In addition, I want to emphasize the great work that the various health departments around the state have been just incredibly generous with their time, intelligent with their advice, and flexible and using common sense with good science. And so my own background, I was a biology professor, taught courses based in epidemiology. So I'm proud that the schools that I represent have been focused very much so on using the data that's out there, best practices, and science that we can trust to make our decisions for reopening. Because what we focus on is that personal attention. Our schools have much smaller classes on average than the larger universities. The personal attention is essential. So for us, having students come back and have the face-to-face classes and the campus experience is absolutely essential for the kind of transformative education that we offer. So we feel really blessed to be in Nebraska and in the various communities we're located, which compared to so many other places in the country, we feel like we have a really good opportunity to have a safe return to campus. What else would I like to share? Our campuses, therefore, as Paul noted, have put in place a variety of test protocols, and as well as temperature screenings every day, continuing to work and partner with our health departments for testing. We're also, many of us are going to receive some Test Nebraska test kits in order to implement the testing on our own campuses and then take the samples directly to the labs or to a testing site. We, of course, are implementing stringent requests for the students, faculty, and staff to wear masks, socially distance, even on the green spaces around campus, trying to make sure if you can't socially distance from each other, you need to wear a mask. At Nebraska Wesleyan, we just had our commencement from the 2020 graduates on Saturday at our outdoor stadium, and it gave us great confidence and courage that we have people who understand the importance of remaining safe and healthy. Students that come from Nebraska just tend to have a great attitude, a great sense of commitment to protecting others. So We have already had small class sizes, but most of us have found ways to reduce the number of desks in a room to have even having the 6 feet between desks in order to continue to try to maintain the health of our campuses. I think we're all primed and ready to do the necessary testing to identify any infections and then quickly move through contact tracing through the state in order to quarantine and isolate students. So all campuses have identified spaces on their campus to house students who have been exposed to somebody who tests positive or has symptoms, as well as sometimes isolation rooms where students who have tested positive or have symptoms can live until they're well again. One last thing, well, a couple of things. First of all, athletics. The percentage of students who participate in sports at schools like ours is often much, much higher than at a large university. It's not unusual for it to be 35% as it is at Wesleyan to 60 or 70% at some of our campuses of the 13. Therefore, athletics is an enormous part of the campus culture, not just the cultural experience of attending games, but the cultural experience and growth potential of being a student athlete. Therefore, the 13 schools actually are in 5 different athletic conferences, 2 of us in NCAA, including Creighton, who's Division I, Nebraska Wesleyan Division III, and then the other schools that have athletics are in the various NAIA, 3 different conferences within NAIA. We've all been working very closely to work with our national organizations, work with the conference on setting processes and protocols, and our local health departments to determine what the best way forward is. It's a daily conversation almost as we continue to move forward on trying to offer athletics. Finally, just want to emphasize that we are not in a vacuum. We often think we're in a little bubble on our campuses, but we know that we are enriched by the communities in which we live. We know that between internships, off-campus jobs, and just the rich fabric of the communities around us, that we rely on each other. We're deeply intertwined in a really important way. So not only do we feel it's important to protect our students, faculty, and staff, but it's essential that we do so to protect the community members around us as well. So we take that responsibility very highly. I'll stop there, but be happy to answer questions later. Thank you.
Thank you, Dr. Good. Appreciate it. And I'm glad to hear that you're not going to be penalizing students for attendance, because I think a lot of college students are glad that you're not going to be doing that. But I'm glad you are taking attendance, because that will help us with contact tracing. So thank you very much. I also should have mentioned that we've got Vanita Soder, who is with Union College, and you've started back in classes this week, right? Today is the first day of classes, so congratulations on that. And then Treva Haugard, did you get that last name right? Who is the president of the Independent College Association. All right, great. So thank you both very much for being here today. And we have questions for you as we get onto this. Next thing I wanted to just address is that there was a lot of attention given last week that Nebraska was put by the White House and the CDC in their red zone. And part of that was driven by us having, according to them, a 10% positivity rate, which we haven't had. So we're like, well, what's going on here? How do we end up on this list? So we dug into the data, and what we found out is that the White House is using bad data. One of the things, for example, is what we do is if you are, say you go to a hospital from a nursing home, you have to test negative to get back into the nursing home. So there may be multiple rounds of testing where you still test positive before you get that test negative and can go back. Well, that's only one person. So we don't count that multiple test positive on one person as part of the numbers we report. But the White House was not sorting that data out of their data. So that one example of how their data was inaccurate. And so if you look at our data, we have never crossed that 10% positivity threshold. So the White House putting us on that list, in my opinion, was a mistake. And I don't believe his advisors are serving the president well if they're giving him bad data about what's going on here and don't take the time to actually get the right data from the states. And in fact, if you go look at the report, they actually say their data may be wrong. So I'm like, well, why are you even reporting it if you know your data may be wrong? One of the other things that as we dug into this was they said you had to have 100 cases per 100,000 and a 10% positivity rate. But as we went back and looked at it, they were kind of doing either or. They were not being consistent with regard to that either. So they probably should modify their document to say they're doing either or. And again, just to put in that perspective of how, this one-size-fit-all answer doesn't necessarily fit smaller states like Nebraska. If you had one, like they also did their hotspot cases or hotspot counties, McPherson County, if you have one case, that would be the equivalent of 166 cases per 100,000 because there's just a little over 600 people in McPherson County. So you can see it's just not commonsensical the way they're approaching how they're doing this and some of the measurements they're putting on it. So we're going to continue to work with the White House on trying to get them to actually reflect accurately what's going on here in Nebraska. As I said, I don't think the president's advisors are serving him well by giving him bad data. And part of the problem is that some people see that and then they use that to make decisions on other things as well. So another reason why the White House probably ought to do a better job on their data collection and how they're reflecting it. Also want to remind people that if your job or income has been impacted by the coronavirus, you may be eligible for the Workforce Retraining Initiative, which is part of what we're doing with the CARES Act. We've got scholarships for our community colleges to be able to help you get, say, a certification that will help you get a better job. So please, you can go to the Department of Economic Development's website, get Nebraska, growing.nebraska.gov, or you can go check with your community colleges. They've got navigators to be able to help you with this, but it's a great opportunity. We've got lots of scholarships still available for people to be able to get that certification to help them get a better paying job. So that workforce retraining reminder is out there. Please, initiative is out there. Please go get that. Upcoming schedule. So on Thursday, we will be doing another press briefing with regard to our community colleges. So kind of the tie-in from the Workforce Retraining Initiative there. We'll talk about our community colleges and what they're doing to get ready to have students back for this fall, as well as the legislature is scheduled to end sine die on Thursday. So typically I do a sine die address and then have a press availability after that as well. So that'll be something also coming up on Thursday of this week. And with that, we'll go ahead and open up to questions and answers. So Taylor, as always, we'll start with anything that was sent in ahead of time.
Yeah, Sean Callahan with Husker Online wants to know if you're supportive of the Big Ten playing sports this fall. He said that the governor of Florida has come out in support of playing this fall and wants to know if you have similar comments.
So sure, Sean Callahan from where?
Husker Online.
Husker Online wants to know if I'm supportive of the Big Ten having athletics this fall, and I am. One of the things that we talked about last week was with the Big Ten putting out their football schedule, having conversations with our local public health director here in town, the president of the university, about planning for what we do to be able to, for example, hold football games at Memorial Stadium. What would that look like? Certainly would not look like what it did last year. There'll be a number of different changes, wearing masks as an example, but I believe it is absolutely something we can do here in Nebraska.
Becca from NET wants to know, she had a follow-up question to your comments about the positivity data, and she wants to know if the data on the state dashboard is sorted in the way that you mentioned. Do we double count positive cases in the state dashboard, or are those deduplicated?
No, and we've got our data experts here, so I'm going to make the statement, then I'll check with them to make sure I'm right. But we deduped that. The public dashboard we put out there is deduped, so it's only showing one person. Is that right, Ashley? And Ashley's nodding yes, so yes, I got it right. So yeah, so the state dashboard we're out there is only showing one person. And again, I just did the math. I went back and looked at our state dashboard and just took how many cases we had test positive, how many tests we did, and did our test positivity rate. And I came up with like 7.9% for the week ending yesterday, Sunday, August 9th. The week before that was 9.43%. And that was the week that also included one day where we had 12% positivity rate. So that was kind of the high that we've had. So our test positivity rate is actually coming down here in the state, week over week from the week ending August 2nd to the week ending August 9th. And again, if you look at Douglas County's dashboard, they reached a peak on 8/2, August 2nd, of 11%, and they're down to 10.2%. So again, I don't know how the White House could possibly be getting that we had an over a 10% positivity rate. I think you just go to our public dashboard and look.
Becca also has a question for Dr. Good. She wants to know, when test Nebraska kits are used on college campuses, who will collect the samples and then deliver them to the lab?
Dr. Good, I'm going to let you talk.
Yeah, so the question came in, I can't remember from whom. Becca at NET, how the Test Nebraska test kits are going to be administered and then delivered back to the state testing labs. So each of our campuses who are receiving these test kits are having individuals on our campus trained in order to administer them correctly, either in most cases through the National Guard, who have been doing a lot of the testing. So we're going to have people trained on our campuses to administer the tests accurately and correctly, and then in most cases then we will have a courier hand deliver them either to a local testing site before 6 p.m. each day, who will then have it taken to the state lab, or those of us nearby here in Lincoln will deliver them directly to the state testing lab. Thanks.
Anything else, Taylor?
That's all I got so far.
All right, folks, questions here in this room? Yes.
Governor.
Grant, we haven't seen you in forever.
Social distancing.
Good, good. Well, it's good to see you.
You have, it's looking like the latest federal coronavirus package is not going to have any assistance for the state, at least at this point. Do you have any thoughts or concerns about that?
So with regard to the next round of federal legislation and not having anything for states, what I've really requested is just give us flexibility with the dollars you've already given us. There's a deadline of using it by December 30th, but we know we're going to have expenses that are going to roll into the next year, so flexibility on that. Flexibility on what we can spend the money on. Those will be the sorts of things that aren't going to cost the federal government any more money. They'll be very easy to give us more flexibility with regard to how we at the state can use the dollars they've already given us. Other questions? Yeah. Paul, I'm going to have you come up.
Talked about this pledge that college students were taking is kind of individually tailored to the campuses. Is this something that students are signing, or just that they're given the literature to it, or what does that look like?
Okay, good question, Chris. The question was, what does the pledge really look like on the campuses? It's not anything that they're being asked to sign. I think the one thing we recognize, it would be extremely difficult to monitor and enforce. And so in encouraging students to recognize these are the things that are going to help us stay in person on our campuses as we start to see some of that erode and break down, the likelihood of us having to shift to remote. So I think a number of institutions around the country have adopted similar things, some forcing them to sign. Our decision was no, we'll just brand it in the right way, continue to reinforce that these are the 4 or 5 things that will help ensure that we're going to maintain our online or on-campus in-person delivery.
And who's providing tests for your campuses?
We've been working with the governor's office, Doug Carlson, and getting access to specific test kits through Test Nebraska. And very similar to what Doug had noted is that we're being able to kind of work with courier systems out at Shatter and at Wayne and down at Peru to get them into the cycle. In addition to right now, I think we've been fortunate that the Guard has been working very closely with us. We have students on campus at Peru today. Our athletes come back for the start of practices, and they're facilitating some testing and doing the training that's necessary so that we can do it ourselves down the road as well.
What's the contingency plan if there is an outbreak at either of these schools?
Okay. So the question was, what are our contingency plans? I think the one thing we recognize that I think most higher education is probably going to approach this in about the same way. I think Ted Carter, when he's been here presenting before, the likelihood of us simply saying our entire system is going to shut down, I think that would come from when the governor says we're at a place where that has to happen. At this point, we'll monitor each location, assess what's happening there, determine where, all right, now is the time. We've got such a spread that we probably need to shift to remote, but that may not be asking asking students to leave campus because it's probably the best place to maintain them until they can be isolated and work through a quarantine process. So we'd like to see that done individually at each one of our institutions, rather than saying an outbreak maybe at Peru forces us to do something different in Dawes County. I mean, to date, Dawes County still only has had 4 cases. If I had to go back into last March, knowing what we know now, I think about the only thing, if we had PPE and all the different things, the state resources that are available, many of us may have made some different decisions back then, but just simply knowing what we didn't have access to meant we need to all have to find a way to kind of flatten the curve as best as we can.
And actually, that's a great point. You're exactly spot on. We are in much better position today to be able to manage this than we were, say, in March, when we didn't have the resources of the testing and the contact tracing, the PPE, and the ability to do the isolation, and all the different plans that you all are putting in place to be able to help do that social distancing in the classroom. Did you want to come up and answer a little bit of that question, too, about contingency plans, Dr. Good?
No, I'm good.
You're good? Okay, he covered it? Great. But again, I think the thing to keep in mind is the steps they're taking with regard to social distancing, creating more space in the classroom, having people wear masks, doing the screenings, that will help mitigate this. And then if we do, and when we do, I should say, we will have students almost certainly test positive. We will do the same protocols we do with the general public, which is, okay, that person got tested, they were determined to be positive, we're gonna get them to isolate, we'll do the contact tracing, right, to make sure we know who else they've been in contact with. Thus, the attendance lists are gonna be important, so we can go back and talk to those folks and see if they had a close contact. If they did, they'll be asked to quarantine. If not, they'll probably just be asked to monitor their symptoms. So it'll just be a, kind of the standard blocking and tackling of how you handle any pandemic. Yeah, Martha.
For Mr. Good, I'm wondering about Creighton in particular, but they're in a metro area which has had the highest, currently has a high rate of positivity, so much so that OPS has decided to go remote for the first few months of the semester. Why, what's the thinking is in going forward with in-student classes there?
And the question was in particular asking about Creighton in a city of Omaha where the positivity rate or the infection is concerning enough that OPS has chosen to not have face-to-face classes. And I apologize, not one to dodge questions, but I do not want to speak for Father Hendrickson and Creighton. I could extrapolate based on what we think at Wesleyan, Nebraska Wesleyan feels that we can be small and cohesive enough of a community that I know one of the things that Creighton they're doing is having students sign a pledge agreeing to behave in certain ways that can help them protect their community. They're testing all students who are moving into the residence halls as they arrive and are going to continue to monitor things closely. So I think they have an ability to maybe have students who are willing to protect each other, protect their community in a way that is different when you have families going out or students going back home to their families and then coming back to school day in and day out. There is a little bit more of a bubble around a college campus. It's permeable, it's leaky, but there's a little bit more control that I think I have confidence that they have a good handle on how to do this well.
So I think, are these for Dr. Good? Okay, Dr. Good, say that, please.
Okay.
I was wondering if you would be able to give some examples of how some things might look different when students go back to classes, like cafeterias, I know Greek life meetings, different things like that.
Absolutely. And so we have been very candid with our families, and when we meet with alumni, repeat the question. Yes, the question was asking for some examples of how things are going to be different as far as the return to campus. And so Great question. Some examples, just the packing lists. Even though many of us are providing masks to every student, faculty, and staff, we also encourage them to bring their own. Going to be asked to check their temperature every day. In addition to having temperature check stations around campus. The cafeteria, we know we're making adjustments to have a lot more grab-and-go box lunches or easy to sample salad bars that are held or kind of put together by a worker rather than each student handling them themselves. We've are prepared with more custodians because with all that extra box lunches around campus, we know that's going to create more refuse. As far as how it's going to be different in the classroom, depending on how many students can be seated in a class, many times students may attend live face-to-face with the professor on Mondays and Fridays of a week, and the other half of the class might only come on Wednesday and then the following Monday. Oftentimes the students will Zoom in so that there is that live interaction with the professor. Just as a reminder, most of us are not research-oriented schools. We are much more teaching-focused. So the quality of teaching and that interaction between professors and students is of paramount importance. So we've talked about students wearing masks in the classroom, professors wearing masks. However, we know if there's a student who's hearing impaired and needs to be able to see the lips, that a professor needs to be aware of that so that they can wear a face shield and will probably extend the distance between them and the students even more, or have a plexiglass to try to protect things a little bit more. So I'm just totally impressed with the hard work happening on every campus to create the processes and protocols. And we're not in a vacuum. We look at what other schools are doing around the country and take the best ideas that'll work here in order to create an environment that has the lowest risk and yet that high quality educational impact that they come to attend our schools to get.
And it was just for Dr. Good?
Yes, what are your enrollment numbers showing for your membership schools? How financially stable are your schools, your membership schools, and how important is fall sports to that financial stability?
That's a great question. So the question was, how are the enrollment numbers looking at our 13 independent or private colleges and universities? How financially stable are the schools, and how important is having fall athletics? And it's hard to answer with one voice for 13 schools. So what I can say, we at least through the CINCF Council, we have asked each school how things are looking. To a school, everybody feels the enrollment numbers are good. In most cases, right on what they expected or slightly below. So every school has reported that they feel financially confident that they can move forward. The athletic impact, we know, as I pointed out earlier, a large percentage of our students play varsity athletics. We know that some of them, they make a choice to come to a school that's a Division III or NAIA, so that if they're not going to play at the higher level, Division I or Division II with scholarships, they at that level, I should say, that they can keep that joyful part of their career and life going. And so we don't know how it'll play out if we have to move to canceling sports. We believe some students will choose to sit out a semester or a year if they can't play one of their sports in the fall. But we also feel that we're doing everything we can to keep that bond and cohesiveness and having workouts possible with athletes, even if they can't play competition. Thanks.
Do you have one question for Dr. Good, or anybody else for Dr. Good, as long as he's there? Yeah.
Well, the NCAA announced last week that it was canceling the fall championships for Division II and Division III schools. Right?
Correct.
Does that change how you go about this, particularly at a Division III and some Division II schools?
Exactly, and that's a great question. So Division III, in our case, athletics, the NCAA has canceled the championships, and therefore they put together the guidelines of what it means to come back to play. To be quite honest, we're very high level, more geared toward Division I in our opinion, but we have done everything we can to try to meet those expectations in order to keep our players and our communities safe. So the point being, even if there's not a national championship at the end of the fall season, we still have a strong feeling that providing our student athletes a chance to compete within the conference, the American Rivers Conference that Nebraska Wesleyan is associated with has a reduced schedule plan for the fall with about half the number of games and almost all in-conference, no non-conference games.
How do you plan to enforce the mask mandate on campus? And can you get expelled or suspended?
Dr. Good, that's for you.
Why don't you jump in there?
All right, Paul, we're going to give you a chance to talk.
Yeah, you tell what happened to yours.
Yeah. So the question was, how do you enforce the mask mandate? I don't know that it's all that different than local businesses and entities that require that to come into the facility, a Walmart, a Menards. Right now, we do have particular frameworks about what's required in the classroom. The faculty get to decide what those things are. I mean, you don't go to a chemistry lab and get to decide that I'm not going to wear my safety goggles to class. And so we've identified that a mask is required not only to protect students and your fellow students, but also the faculty that we have and the staff as well. And so our board policy already has a framework for what we do in those situations. We would hope that it would not come to a place where we have to suspend a student. I think that's why we've tried to really reinforce, 3 weeks leading in. These are the things that are going to help us be successful. Your commitment to doing these things, at least while you're in class or transitioning or not able to do social distancing, by doing that, we're all going to be a lot safer and we're all going to be able to stay in person for a lot longer, which is exactly what they want. So.
But a teacher could prohibit a class person to come in if they don't wear a mask or kick them out if they don't wear a mask?
That is correct, yes.
Should you just repeat that for everybody?
Can a faculty member ask a student to leave if they're not wearing a mask? Yes. The guidelines that I've posed to the campuses require face covering in the classroom, especially in a situation where social distancing is not possible. So a faculty member, if I only have 5 or 6 students and it's a relatively large class, you can make the choice of come in the transition and the mask can be removed, maybe while we're doing speeches in a public speaking class. But beyond that, it will be required and the faculty member gets to decide what is the requirement in the classroom itself. So.
Can a faculty member be disciplined for not enforcing it?
Can a faculty member be disciplined for not enforcing it? Yes, we would have the capacity to work through our existing protocols and HR structure to do that, yes.
I hesitate to speak for 13 campuses, but I think we're probably not much different in Nebraska Wesleyan than others. We have provided to our students the code of conduct, the expectations for keeping the campus safe and protecting us from the coronavirus. Each student then will, as part of their contract or to be in a course, will sign an explanation of what their requirements are for participating in the class. So would a faculty member be expected or be able to ask a student to leave? The same answer, just like in a lab, chemistry lab, that's a great analogy. I would say the same thing as far as a faculty member not requiring students to wear masks. I think that would be problematic for us. We would want to discipline a faculty member because they're not providing a safe environment for the other students in the class. And so it would be an expectation for everybody in our community to follow the coronavirus best practices on our campuses.
Is that for him?
For anybody, I guess. How do you, if students only have, they're on campus for a certain time every day, they have a lot of leeway to leave campus, go to parties, go to bars, those kind of
So the question was, how do you manage students who, okay, you talked about the classrooms and wearing a mask, but then they go out to other activities, they may go to stores, they may go to restaurants. How do you make sure they're doing the right things there? Bars, parties. Well, many of the students probably aren't going to be old enough to go to bars, though I suppose seniors are. But there's still going to be parties and things like that. And Paul, I'll let you take that one to start with.
That's a good question. And I think what we've seen some bad cases of that already happen in the last couple of months in higher education. A number of institutions actually enforcing. We look at the student code of conduct and how we can try to encourage students to not facilitate those types of behaviors. I think one of the reasons why the pledge is such a good strategy of continuing to reinforce that this is not just what happens on campus. All of these three principles, hygiene, screening, social distancing, face covering, is going to be important when you leave campus as well. I know that during our conversation with the governor and his staff last week about testing, I mean, this is much about a student who comes, and our goal is to try to keep them there for the 14 and a half weeks that we have. The compressed calendar was, put in place for a variety of reasons. But we'll have students that want to leave the campus, and is that a situation if you're going back to elderly parents or a community that's relatively small? You should probably, a day or two before you go, get tested. If you don't, when you come back from a larger community, it's good to get tested. We feel that we've got the testing capacity to do those things. So it's getting people to not only follow the behaviors, but accept that asymptomatic individuals are going to be the ones who spread it the most, and be willing to do testing more aggressively than what you've been willing to do in the past. So, Doug?
Yeah, I believe our best asset, our best ally on our campuses are the students themselves. We're working at Wesleyan to really find who are the student leaders. I've talked to the athletic coaches, asked them to find who are the student leaders on their teams, athletic team captains maybe, who can really send a message to their peers that will resonate. Again, we're the grown-ups around there, and we can say things that might resonate with some, but we really believe that what we're needing to do is have a public service announcements campaign that's centered around the students speaking to each other. They can better understand and empathize with each other. What are you going to lose in your academic experience if we don't all do this on campus and when we're off campus? Theater students, fear losing out on more performances. Athletes worry about it, but all students worry that they'll go to completely online learning, and maybe not have all the experiences on campus that make it that joyful, holistic, deep educational experience. So we think our best allies are the students themselves, who really can speak to each other in a way that we can't. So we're utilizing them to really help advocate for good behavior.
And again, just want to reemphasize that the reason we put all these restrictions in place, the 6 foot of distance, the wearing the mask, all the things that you're doing with regard to screenings, it's about slowing the spread of the virus. It's about trying to slow that spread. Ultimately, slowing the spread, but it's about preserving the hospital capacity. So we've done that very successfully here in the state, which is why I'm so confident that the steps the state colleges are taking and the independent colleges, private colleges are taking, the University of Nebraska is taking, will help us preserve our hospital capacity. And Martha, you were asking about Omaha. In Omaha, we've got 1,596 hospital beds. 96 of them are being used by coronavirus patients. So it's a very small number of our hospital beds are being taken up. I think there's 14 people on ventilators in Omaha right now that are coronavirus related. So we have been successful here in the state in preserving our hospital capacity, and ultimately that's go for all the restrictions, all the steps we took in place is to protect that hospital capacity.
Governor, the property tax plan is going through the legislature.
Property tax, you're changing the topic here, Fred? Okay, all right, look at that.
You're a numbers guy. His most aggressive calls for $125 million next year, $250 million the second year, and $375 the third into this new property tax credit fund. That's $650 million over 3 years. Last year, property taxes in the state went up by nearly $200 Nebraskans really expect significant lower property taxes if this plan passes?
So the question was with regard to the property tax relief plan and the significant amount of money that is being dedicated to it, but how much property taxes continue to go up here in the state. And it gets back to the original plan that we had, 1106, had those expense controls in it so that you could actually make sure you were controlling how fast property taxes went up. So this plan here only really has half of what was originally proposed from the standpoint of it's got additional relief for our Nebraska taxpayers with regard to more state resources going to help offset those higher property tax bills. Because remember, again, we at the state, we don't collect property taxes. That's all your local entities, your school boards, your cities, your counties, your NRDs, your community colleges. Those are the folks that collect your property taxes. We, the state, don't. So we're providing more state resources to help offset that. The second part of that, which we wanted but did not get, was the expense control side. So, but it's a compromise bill. We're making progress. We're getting something passed that will assist with property tax relief. It's a great step in the right direction. We're providing significant more dollars to helping that property tax relief, but it doesn't have everything, but compromises work that way. Not everybody's getting what they want, and this is still a step in the right direction, which is why I applauded the Revenue Committee and the group of 7 who put together this plan, and especially I want to thank Speaker Scheer for his leadership in pulling together this compromise to be able to get it to the floor, get it past one round of voting. We still got 2 more rounds of voting to get to. So I encourage the legislature to get this done in the 3 days that remain in the session, get this passed, and then we can work on what do we need to continue to do in the future. Martha.
When you talked about the testing and positivity rates, is the White House looking at Nebraska's numbers differently than they look at other states' numbers, or is that just the way they do it, and so every state has some duplicates in there?
So the question was, is the White House looking at Nebraska differently from other states? And I don't know the answer to that. We have been very focused just on the state of Nebraska. I don't know how they're treating other states, but again, I would say that the White House ought to work closely with the states because we are the people that are actually collecting the data and understand the data. And again, we want to reflect the most accurate data that we have, and the White House isn't doing it right now.
And are those positivity rates available on the state's dashboard? I don't remember them being there.
So are the positivity rates available on the dashboard? No, actually, I actually just calculated those. I mean, the data's out there for you just to, it's very easy to do, right? You look at how many cases do we have on a given day, which is on there, and then you look at, how many tests did we do? Just divide the case of the test, you get your positivity rate. But that's actually one of the things we could do, because I did notice that Douglas County is portraying that, so maybe Felicia, Ashley, we take that as a to-do to start displaying those positivity rates. That'd probably be a good idea. We could help the White House out by doing that. So thank you, Martha.
Have you asked to be taken off the White House's list?
Have we asked to be taken off their list? No, we haven't asked to be taken off the list. We just are working with them to try and get the right data so they can have the right data.
Time for just a couple more questions.
A couple more questions. Andrew. My understanding, Dr. Burks is supposed to be coming to Lincoln, but I don't have that confirmed. Taylor, do you have it confirmed yet? Don't have any more detail than we had last week.
Do you know why she's coming?
My understanding, Dr. Burks is making a tour of Midwestern states to sit down and talk to them about the pandemic response, and Nebraska is one of those states. Fred?
President Trump's latest executive actions call for the states to pay $100 a week towards the enhanced unemployment, extended unemployment benefits. Can Nebraska do that? And did you have advance notice that this was going to be a proposal?
So the question was, the president's executive order calls for the states to pay about 25% of the $400 that the president is recommending with the additional pandemic employment, but the states would have to pick that up. And are we going to do that? We're analyzing that right now, so I don't have an answer for you. So I'd say stay tuned on that. And then the other part of the question was, did we have advance notice on that? And we did not have advance notice on that. So again, we just kind of found out about this, so we're just kind of working on it right now. Last question. Oh, we'll go we'll go last question, but yeah.
You spoke on it a little bit earlier, but there's been multiple reports about the Big Ten possibly canceling football this fall. Have you specifically talked to UNL president or some of the coaches about, like if it were to be canceled, what would happen or the impact it would have on even businesses around the area?
So the question was, there's been news reports that the Big Ten is planning on canceling the fall athletics And have I had conversations about what that would mean from the standpoint of businesses in Lincoln with the president of the university? We've not had any of those conversations. I would say, again, there's been no official notice on that, so I'd refer you to the university with regard to that. They're going to be the ones dealing with the Big Ten. The Big Ten doesn't call me, so I don't have any more information on that. Last question, Brendan.
And actually, a follow-up to that, 12 of the 14 presidents have been reported this morning saying they voted against having the fall football season. Nebraska and Iowa were the few that are being reported that are pushing for it. So if that's the stance of the university, what does that symbolize in terms of how Nebraska views the situation?
So Brandon's saying that there was a news report out today that you said 10 of the 12? 12 of the 14, 12 of the 14 schools voted against having a season, but Nebraska and Iowa were voting for having a season, having the season this fall. Again, Brandon, I'd refer you to the university with regard to that. I don't have any knowledge of that. All I can tell you is that in my conversations with President Carter, we were fully supportive of having fall sports here in Nebraska. We were confident that we would be able to do that and be able to manage it. Again, it wouldn't look like it did last year, but we're very confident that we could have fall sports here and manage it here in the state of Nebraska.
Can I speak in one?
Andrew, you're cheating. Okay, I'll give you one last one, but only because I like you.
Ever since this whole thing started, how many cabinet members have come down with COVID-19, and then how do you handle that?
So the question is, since this whole thing started, how many cabinet members have come down with COVID-19? I believe we've had 3. And just like all the rest of our teammates, we encourage them to stay home and follow the CDC guidelines with regard to recovery and all that. So
Have they all recovered over there?
I believe we've got, have all 3 recovered? I believe all 3 have recovered. So yes. All right, folks, again, thank you very much. Appreciate everybody coming for our press briefing. Remember, we'll have another one on Thursday, more back to school with the community colleges, and I hope everybody has a great week. Thank you very much. All right.
Thank you.
All right, really good. Yeah.
Thanks.
Great job, guys. Great job.
Most of you.
Thank you, Francis.
Thanks for your guidance. So, thank you.
Thanks. Trina, thanks.
Can't say that.